right, everybody, thank you. Welcome to the National Rural Health Day celebration for the New York Association for Rural Health. I'd like to introduce Tammy Austin-Ketch, who's going to facilitate our discussion today.
Welcome and good morning, everyone. I'm Tammy Austin-Ketch, Dean of the College of Nursing at Upstate Medical University and a member of the NYSARH Board of Directors. I'm pleased to be your MC for today's events. At this time, I'd like to welcome NYSARH President Michael Pease for opening remarks.
Thank you, Tammy. I'll keep this brief so we can keep things rolling. I just want to take the opportunity to thank everybody for attending this. We all know that rural health is incredibly important and frankly, often forgotten, I feel like. And this is a good opportunity for us to reflect on all the positive things we all do in our different roles in rural health communities. And I think, again, the most important piece of NYSARH is its members. And we've talked about that in multiple committees at the board level as well. And we value everybody who is able to make it here today and those who will end up listening to this afterwards, we hope. And we're happy to have great folks speaking today and recognizing some really wonderful people. And I'll pass it back to Tammy.
Thank you, Michael. Karen Madden helped to create the National Rural Health Day. She's been a strong advocate for rural health throughout her career. Unfortunately, Karen was not able to join us this morning. There are some other matters that she needed to attend to, but we wanted to recognize her. NYSARH reviews nominations submitted by our members in order to select the people being honored here today. Thank you to everyone who submitted a nomination. To introduce the first nominee, please welcome Nancy McGraw.
Hi, thank you. Oh, what an old picture. I wish I looked that young. I'm Nancy McGraw. I am a board member of NYSARH, currently serving as treasurer. Also serve on the finance and policy committees. I've been with NYSARH for quite a few years in different roles. I'm representing Cornell Cooperative Extension of Sullivan County currently, and I was the previous public health director for many, many years in Sullivan County. It is my pleasure and excitement to introduce Dr. Bruce Ellswig, who was named for this award, selected for this award in honor of Dr. Gary Ogden, the former health director in Allegheny County. Dr. Ellswig is a family practice and primary care physician, and he's with us today live in person. They actually cleared his schedule, believe it or not, to let him join us and accept this award. He was nominated by myself and several other people for this award for his exemplary contributions to rural health, public health, and community involvement in Sullivan County that spanned the last several decades. During the COVID pandemic, Dr. Ellswig was on the front line serving his community by providing guidance, education, and support, not only to the local health department as its medical director and previous chair of the Health Services Advisory Board, but contributed hundreds of hours of his own time volunteering at mass vaccination clinics and supporting emergency operations for almost 3 years of the pandemic while continuing to care for his patients in his practice at Crystal Run Healthcare. Dr. Ellswig is driven by a great desire to improve the quality of life for rural residents, as shown by his extensive community volunteerism with several organizations. He has served on advisory boards for New Hope Community, the local health department, Sullivan County Public Health, as medical director for Prasad Children's Dental Health Program, and serves on the wellness committee at Crystal Run Healthcare in Rock Hill. He's also a social member of the Forestburg Fire Company, a member of the Monticello Kiwanis Club, and the Public Health Commission of the New York State Academy of Family Medicine. He previously served as the Director of Primary Care and Community Medicine for the Greater Hudson Valley Health System in Middletown, New York. He has served in an advisory capacity for Sullivan 180 for many years to help identify ways to turn around the health rankings of residents in Sullivan County, which is consistently ranked 61 out of 62 in the Robert Wood Johnson rankings for many years, only to have improved to 60 out of 62 this past year. Sullivan 180 is a not-for-profit organization that's relatively new, dedicated to building a healthy community through people, places, and policies, with an intentional focus on prevention and empowering a healthier generation. Sullivan 180 is committed to change by degrees, working with partner schools and communities through a grassroots and inclusive approach to address disparities where everyone can participate in turning around the health of county residents. Through his involvement with the Monticello Kiwanis Club, he spearheaded community outreach to educate about the importance of prevention, masks, and vaccinations during and following the end of the emergency declaration, and continues to do so. He spent many hours conducting outreach as well as donating food, and namely his famous bagels, which we always look forward to, and masks to the communities and first responders on the front lines. Dr. Ellswig is a kind and compassionate physician with strong ethical standards. He always goes beyond what is required to care for his patients in his practice. He's affiliated with Crystal Run Healthcare, Garnet Health Medical Center, and Garnet Health Medical Center Catskills, and has interest and involvement in population management, patient-centered medical home, palliative care, and end-of-life issues. I am so pleased that NYSARH has chosen Dr. Ellswig for the Dr. Gary Ogden Rural Health Practitioner of the Year Award for 2023, as we also recognize National Rural Health Day. Congratulations, Dr. Ellswig.
Thank you so much, Nancy. I am humbled and honored to accept this reward. And you listed all the things that I was about to list on, or more than I was about to list in my my discussion. Thank you so much for this honor. It has been my mission since moving to Sullivan County to serve an underserved and not undeserved population to help improve the healthcare. I've been here for about 10 years. I've had the privilege to work with public health services for the last 8 years, and I owe a great debt of gratitude for the mentorship and partnership that Nancy has provided for me in my role in public health. I have enjoyed with Nancy McGraw, as I've worked with Nancy McGraw as the former director of public health, and my continuing desire to improve the health outcomes of a diverse community in our county, with profound needs for access to healthcare and resources, transportation, and quality care, and to work with an outstanding, committed staff at the Sullivan County Public Health Services Department. Special thanks goes to Nancy for the nomination, and to Judge Anthony Kanan, and to Sandra Geary for her supporting references, and especially to my wife and partner, Karen, for allowing me the opportunity to move to Sullivan County in our ripe old age to serve a population that had a great need. And thank you once again. I'd also like to thank Crystal Run Healthcare for their support and allowing me the flexibility to participate in all of the community activities that I enjoy. Thank you so much.
Thank you, Dr. Ellswig, and congratulations as well. Karen Pantel will share information about our second award winner.
Good morning. I nominated Laura Quigley, Commissioner of Community Resources for Sullivan County, and the force behind the public transit system of Sullivan County, Move Sullivan, for recognition by the New York State Rural Health Association, and very fortunately, she was chosen. I have been following the progression of this particular program since probably 2021, 22, where they started to make astounding progress in Move Sullivan. Move Sullivan is a bus transit program that is actually fostered by Rolling V Bus. And we are just seeing Move Sullivan buses all over the county. My concern is, were we doing anything for well-being? And yes, we are. Even during COVID, there was transportation for people to get to the doctor, to work, to socialize. Well-being is so important to good health. Socialization, just getting out, and our routes have extended to many more parts of the county in the very recent past, and we're very, very proud of Laura, who coordinates and is the moving force behind this entire movement in Sullivan County. And I really feel that she is totally deserving, as do her colleagues. Thank you.
Laura has provided a video.
Thank you, and I am humbled by this recognition. I wasn't sure what to say, having never been in this position before, and I'm not necessarily good at talking about myself. But what I can say is that I have always looked to help people, both in my personal and my professional life. I like to solve problems, and the lack of transportation was a major problem for the people in Sullivan County. The county is rural, and early in my career when I was in workforce development, I saw firsthand what the lack of transportation can do to a family. Most jobs, even now, require that you go to a place. And when the choices are limited, your ability to grow your family's economy is stunted. You're stuck with minimum wage jobs and corner store shopping and limited healthcare options. And to solve the problem really required a confluence of groups and factors. You know, in 2017, I was the director of workforce development, and we had just had a successful countywide job fair, and we had 10 phone calls of people who had gotten job offers, but they had no way to get there. And so I brought that to the county manager's attention, and he's like, okay, time is right, let's solve this problem. We had a lot of meetings, a lot of back and forth on things. He worried about the legislature and getting them on board, and then we put a request for proposal out, interviewed respondents, and we chose the Rolling V Bus Corporation. We launched Move Sullivan in August of 2019, and if we all remember, March of 2020, COVID hit and everything shut down. At the same time, I was also then appointed to my current position as commissioner of a new division called Community Resources, which includes transportation, workforce development, Office for the Aging, Veteran Services, and the Youth Bureau. And we started with 2 routes that went through the 3 main towns. We ran all throughout the pandemic, which helped all the essential workers get to work. County elections for legislatures were held, and there were in 2020, and there were some who were not in favor of Move Sullivan. And but through some, they were very open to listening and learning, and some of them became the biggest champions, because when they started to realize that their constituents now had the ability to move around and get better jobs, they saw the direct impact on that. And they understood that there isn't a public transit system in the country that doesn't have strong government support. It wouldn't happen otherwise. We've expanded with 2 additional routes, so now we have 4 routes that run covering 200 miles. And next year we will be expanding more and hopefully getting to some of the outlying areas. We've provided to date over 127,000 rides. And, you know, I've worked closely with our hospital because we are trying to solve the medical transportation issue. And Sullivan can handle some of it, but not all of it. And that work continues. I never thought I would be dealing with transportation, but I must say it is very satisfying, and I am very grateful that I've had the opportunity and the support of the county. And I'm really very grateful for this recognition. I so appreciate it, and thank you very much.
Laura's experience highlights how important transportation is for our rural communities. Now, please welcome back NYSARH President Michael Pease to introduce our last honoree.
Great. Well, thanks. We were asked to keep this brief, 3 to 5 minutes. And I'll just say, the next honoree, I could probably talk at least an hour about, but I'll keep it short. Mary Zelazny, who I think many of the folks that are on here have been kind of watching who's in right now. We've all worked closely together with her in different roles. She's been on the NYSARH board previously. I think the easiest way to talk about Mary is just to say she's a fierce advocate for rural health across the board. It doesn't matter, what race you are, what sex you are. She is a fierce advocate to make sure that everybody receives the services they deserve. And she is a very busy person, so I'm happy she was able to make it on this call today. She's previously served as the board chair of Chicanes, which is the state association's group for the federally qualified health centers. She's served as a member of the National Association of Community Health Centers. I believe she's terming off very soon, but she was fiercely advocating for us while she was there. She's, like I said, she's been on the NYSARH committee. She is the CEO of Finger Lakes Community Health, and has helped that organization grow exponentially from when she first started working with them. I don't want to get this wrong, so Mary can correct me when she talks, but I believe she started as kind of a frontline advocate for folks in the community and grew into the CEO role, which is again another testament to her desire and drive to make sure that we're giving the best services possible to the folks in our communities. And if you haven't gotten the theme yet, we are service providers. I'm another FQHC. So Mary and I worked closely together. And from a personal perspective, my organization wouldn't be where we are today if it wasn't for Mary's willingness to help guide us on different avenues, related to healthcare in general, but also rural health. She's always willing to help. Finger Lakes Community Health kind of started as a group of folks who really helped migrant workers, and has since grown to a lot more than that. But we have a contract with her in our area, and she has many of them throughout the state. So again, I could go on and on. I'll keep it short. Mary's fantastic. I'm so happy she was picked to win, and I'm even happier she was able to be on so she can speak for herself.
Mary, you're muted.
Yep. Thanks, Mike. I appreciate that. So I wrote something because I never know what to say in these things. I've loved the role that I've had over the years. I've been able to do a lot of different things. I did start out as a community health worker. That's how I started out. I wasn't supposed to do this. I was going to be a teacher. And I started as a community health worker for 2 months. It was a summer. And I never left. So, we got the bug, like everybody here probably in healthcare or in rural care. So thank you very much. I'm really honored and humbled to accept this award in honor of Senator McGee. I'm passionately committed to advancing rural issues and access. And I just want to say that this award it's an acknowledgement of the collective work of many individuals and communities dedicated to improving healthcare in rural areas. In our rural counties, where so many communities are faced with challenges in access to healthcare, this award symbolizes a shared commitment to overcoming obstacles and ensuring that every individual, regardless of their geographic location, their race and ethnicity, their socioeconomic status, has access to quality healthcare services. I accept this award on behalf of countless healthcare professionals, community organizers, volunteers, you name it, who work day in and day out to bridge the gap in rural healthcare. It is their passion, resilience, and unwavering dedication that truly deserves recognition. Rural health's not just a local issue, it's a national imperative. We have to continue to advocate for policies that prioritize healthcare infrastructure, workforce development, and innovative solutions that meet the unique needs of rural populations. Through collaboration and collective action, partnerships, we can create a healthcare landscape where no one is left behind. I'd like to express my gratitude to NYSARH for advancing the importance of rural health. It's through your partnerships that we can amplify our impact and drive positive change. Together, we have the power to transform rural healthcare from a challenge into an opportunity for growth and resilience. As we celebrate this moment, let's remember that our work is far from over. There are still communities waiting for better healthcare access, and it is our responsibility to continue the journey forward through health equity. Thank you once again for this incredible honor.
Congratulations, Mary. Can we all just take a moment and give our virtual round of applause to all of our award winners? Congratulations again to all of the award winners for 2023. I wish to offer a heartfelt thanks to the NYSARH members who served on the nominations review committee and to all of our NYSARH members. Thank you for participating today in our awards ceremony.
Thank you.
Thank you.
It's really appreciated.
Congratulations, everyone.
Congratulations.
Yes.
Congrats.
Thank you, everyone. This will be recorded and was recorded, and it will be available on our website to share with others. Thanks, everybody, and have a wonderful day.
Thank you so much.
Thank you,
Be
Sarah.
safe. Take care.